Good day. This is Dr. David Anderson. I will be teaching the section on environmental health. We'll start with Chapter 20. Basically, I have a PhD in Masters of Public Health and Environmental and Occupational Health. I've been involved with industrial hygiene, occupational safety, environmental health for a number of years and have several credentials to go along with that. What does the government do in environmental health? Well, each individual cannot control their own environment per se, so the government has established environmental regulations on environmental health. In the early days, local governments were supposed to provide clean and safe drinking water and dispose of waste, but as the population has grown, we've had many more environmental problems that have gone above and beyond the local government's abilities. So in the 1960s and 70s, we had state and federal governments take more responsibility into these items of concern. Now we've got a huge world population growth problem that has led to additional environmental problems. Not to speak of other problems such as depletion of the ozone layer, accumulation of greenhouse gases. All these things may contribute to becoming major concerns of environmental health. What are some of the hazards involved in environmental health? Well, they could be multiple, including things like radiation, both ionizing and non-ionizing. We know that ionizing radiation has the ability to break apart molecular bonds, whereas non-ionizing radiation simply energizes or increases the energy of the molecules. Mercury's been around for a long time. We've known about mercury and the hazards of mercury for a long time. It's an interesting material in that it is a liquid metal and it evaporates, so it creates a mercury vapor hazard for inhalation. Lead, arsenic, asbestos, pesticides, industrial chemicals. All these things have been around for a long time and have been known to be hazardous to people and to the environment. The federal government establishes research programs, establishes standards for exposure limits, performs monitoring, and enforces regulations involving environmental hazards. And of course, one of the primary organizations that we hear about include the EPA, or the Environmental Protection Agency. A little bit more on radiation. Artificially produced radiation may cause worry in people, things like X-rays. The sun's ultraviolet light may lead to excessive skin cancers and melanomas. We'll talk a little bit more about radon gas. It's a naturally occurring gas that comes from the decay of uranium, potentially can cause lung cancer and other things. In the early days, when they were back in the 30s, they were developing glow-in-the-dark watches, and the manufacturers were using radium to paint on the dials of the watches in order to sharpen the paint brushes to paint these very fine numbers and details. The workers would put the tips of the radium-coated paintbrushes in their mouth to bring them to a very sharp point. They were ingesting this radium. It caused many cancer outbreaks over the years. Chronic exposures to X-ray, we know, can cause problems in medical and dental care. And then the health effects of radiation have been confirmed by the long-term studies of people who were exposed to nuclear emissions, primarily in Japan from the end of World War II bombing areas. Mercury causes neurological damages. It's a neurotoxin. There's a case that mentions the uh, Minamata disease in Japan, where the mercury contaminated rice crops. Let me back up. Mercury contaminated water was used to water the rice crops in Japan. The mercury was uptake into the rice crops. People ate it and they got very sick. We know that coal emissions from power plants can produce mercury vapor that affect both water and air, and in the long run will contaminate fish in the oceans. Nursing mothers and young children should not eat fish with high mercury content. That kind of makes sense. In the old days, we had mercury thermometers in laboratories, in schools, in hospitals, and if they broke, they had a significant exposure potential. I've done some indoor air quality studies regarding broken thermometers, and it's amazing how much a little droplet or a little globule of liquid mercury can produce the concentration of vapors in the atmosphere. Lead, boy, we've heard a lot about lead recently. It harms the nervous system, the brain, especially in children. It's been a source of known poisoning since the Roman Empire. It gets contaminated in the water supply if they use lead pipes or lead solder. And of course, one of the more recent incidences have been the water supply problems in Flint, Michigan. Back in the 50s, 60s, 70s, we used leaded gasoline as this was consumed in a combustion engine. It produced small lead particles. That was a major cause of lead and air pollution, and it settled along the roadways. Lead-based paints were used until 1977. It's a threat in older houses, in peeling paints and contaminated dust. Children like to eat the lead-based paint because it tastes sweet to them. So it can build up in their bloodstream over time and cause neurological damage. So it's recommended that children be screened for blood lead levels. Arsenic, typically called the king of poisons, been around for a long time, was used in the old days, the Roman Empire before, to kill people. Long-term exposure can cause risks of diabetes and cancer. In an industrial setting, arsenic exposure also leads to skin cancer. People who have private water wells may be drinking high levels of arsenic in their water as it comes from naturally occurring leachates from the soils. Asbestos. Boy, a lot about asbestos too. I've done a lot of work on monitoring for asbestos, both from an occupational and an environmental hazard standpoint. Typically still used in brake lines, gaskets, and so forth. From a construction standpoint, it was used in insulation and other construction products like cement asbestos boards on the sides of buildings. Required in the schools because it is strong and fire resistant from the 40s to 1973. We know that exposure to asbestos fibers can cause scarring of the lungs called asbestosis. It may eventually lead to a specific type of cancer called mesothelioma or mesothelioma, depending on how you pronounce it. It can also lead to lung cancer. Interesting thing about asbestos is that when people who work with asbestos smoke, their likelihood of developing lung cancer is about 90 to 100 times compared to a smoker who may be about 8 to 10 times, or strictly an asbestos worker who may be 8 to 9 times higher than a non-asbestos worker. So the combination of both exposure to asbestos fibers and cigarette smoke are called synergistic. What that means is that the net result is multiplication efforts in developing diseases, and it gets to be very tricky. One of the major producers of asbestos was the Johns Manville Corporation, and they went bankrupt in 1982 because they had so many outstanding litigation claims against asbestos exposure. Um, Libby, Montana was another case where we had problems with well, I guess the company knew about asbestos containing products in vermiculite, but they didn't tell the workers. So there was some high exposures there, and it actually caused the entire town to be cleaned up. And when the World Trade Center was uh, demolished and cleaned up, we had a lot of people exposed to asbestos fibers there. Pesticides, different kinds of pesticides that cause problems, DDT, maybe an endocrine disorder, PCBs, interesting thing, polychlorinated biphenyls, used as a fire retardant in transformers, but when they are released into the environment, they persist for long periods of time and are not broken down. On the other hand, if they catch on fire, they produce a very toxic material called a dioxin. They are absorbed into the fat cells and are very stable. Now we have other concerns about the environment. Bisphenol A in plastics, phthalates, both of these can leach into liquids and found at low levels in humans, may interfere with hormones, both people and wildlife, and the FDA is investigating these things. Occupational exposures, where I've spent quite a bit of my time, in that we have a lot of chemicals listed that we don't know what the health effects are. Common carcinogens, bladder cancers, lung cancers, lymphatic cancers, neurotoxins, all these things are in the occupational environment with very little toxicology data available. So many times workers are called guinea pigs. Another issue we're seeing now in the environment is called factory farms, or CAFOs, where we have crowding of animals produced to try and produce food, and they produce tons of wastes. And some of these wastes contain things like ammonia, hydrogen sulfide, methane, rainwater. When rain does occur, water pollution can occur, but it's hard to control these things because of the specific environmental regulations and political power in the regions. These factory farms also produce multiple occupational hazards to workers. So many chemicals we have regulations for, but most chemicals we have no data regarding potential health effects. Some of the regulation standards include things like OSHA, the EPA's TSCA, EPA's FIFRA, the Clean Air Act, and a toxicology investigation program called the National Toxicology Program, trying to establish what is toxic, what isn't. We look at risk-benefit analysis, and we know that absolute safety is impossible. In fact, if we have overregulation, it can cause underregulation. So we have to balance the risk between societal goals, including our economic well-being. The political groups tend to favor economic and business interests over the environment and public health. But hopefully, with regulations, we can put of a higher priority on public health. And these are some of the important links that you may be able to use in this particular chapter and in your future public health work as well. This concludes this particular lecture. Hope you enjoyed it and learned a little bit about it.